Today we are going to talk about Terry Schiavo, Jack Kevorkian, and the right to die. Trigger warning, I am going to be talking about death and assisted suicide. First and foremost, the right to die is a concept based on the opinion that human beings are entitled to end their life, aka undergo voluntary euthanasia. Possession of the right to die is often bestowed with the understanding that a person lives with a terminal illness, or they have incurable pain, or they just don't have the will to continue living. And the right to die movement means that they should be allowed to end their own life using assisted suicide, more humane means of ending their life. Or they should be allowed to decline life-prolonging treatment. Now, the question is who, if any, may be empowered to make this decision is often the subject of debate. Some people are all for assisted suicide. Some people are not, of course. Some people think that it is playing God. So today we're going to talk about two people that put in motion the right to die movement. Terry Schiavo. On February 25th, 1990, Terry Schiavo, at age 26, went into cardiac arrest in her home in St. Petersburg, Florida. She was successfully resuscitated, but she had massive brain damage due to lack of oxygen to her brain, and she was left comatose. After 2.5 months without improvement, her diagnosis was changed to that of a persistent vegetative state. For the next 2 years, doctors tried occupational therapy, speech therapy, physical therapy, other experimental therapy. They were hoping that she would return to a state of awareness, and they were unsuccessful. Now, 8 years after she had cardiac arrest in 1998, Schiavo's husband, Michael, petitioned the Sixth Circuit Court of Florida to remove her feeding tube pursuant to Florida law. He was opposed by Terry's parents, Robert and Mary Schindler, who did not want the feeding tube removed, who stated that there were many times where Terry seemed to be aware of what was going on around her. They tried to say that she followed them with her eyes, and they even caught her smiling a couple of times. Now, the court determined that Schiavo would not have wished to continue life-prolonging measures. On April 24th, 2001, her feeding tube was removed for the first time, only to be reinserted several days later. On February 25th, 2005, a Pinellas County judge again ordered the removal of Terry Schiavo's feeding tube. Several appeals and federal government intervention followed, which included Bush returning to Washington, D.C. to sign legislation moving the case to federal courts. Now, after appeals through the federal court system that upheld the original decision to remove the feeding tube, staff at the Pinellas Park Hospice facility finally disconnected the feeding tube on March 18th, 2005. Terry died 13 days later on March 31st. It was originally insinuated that Terry suffered cardiac arrest caused by a hypokalemia supposedly induced by an eating disorder. It was claimed that she was bulimic. Her husband denied this claim, and when an autopsy was done, there was no discernible proof of an eating disorder, but bear in mind that it was performed after she spent 15 years in a vegetative state. If her initial cardiac arrest was indeed caused from an eating disorder and she died 15 years later from having her feeding tube removed, either way, she succeeded in starving to death. Now, this is where Jack Kevorkian comes in. Jack Kevorkian was an American pathologist and euthanasia proponent. He publicly championed a terminal patient's right to die by physician-assisted suicide, meaning a cocktail of medications that will let them pass peacefully as opposed to them having to do it themselves at home. Kevorkian embodied that dying is not a crime. Kevorkian said that he assisted at least 130 patients to that end. He was convicted of murder in 1999, and he was often portrayed in the media with the name of Dr. Death. Now, in 1998, Kevorkian was arrested and tried for his role in the voluntary euthanasia of a man named Thomas Yauch, who had Lou Gehrig's disease, or ALS. He was convicted of second-degree murder and served 8 years of a 10 to 25-year prison sentence. He was released on parole June 1st, 2007 on the condition that he would not offer advice about, participate in, or be present at the act of any type of euthanasia to other person, nor that he promote talk about the procedure of assisted suicide. Now, I don't know if you are familiar with Lou Gehrig's disease, but it's a disease that continuously weakens your muscles. Usually it starts in your extremities and then it spreads to the rest of your body. And while Lou Gehrig's disease is not necessarily painful, it does make an individual feel very, very, very helpless. What's actually your cause of death with ALS is that your muscles weaken to the point where you cannot breathe on your own. The longest the person has lived with ALS is none other than Stephen Hawking, who was diagnosed at 21 and lived for another 55 years. So it opens up many questions on morality, mortality, religion. You also have to think about the person's families, if they have children, parents, siblings, husbands, wives. What about you?